Hello, welcome to Vet Talks with Doc Athena. Let's talk about vaccine for dogs. There are core and non-core vaccines for animals. This video is intended as a guide for pet owners, veterinary medicine students, and basically to anyone who is interested in this topic. Canine hepatitis. There are many kinds of hepatitis in dogs, but in this lecture, we will focus on infectious canine hepatitis, which is caused by a virus. Okay, so if you're familiar with the 4-in-1 vaccine or the DAPP, or sometimes it is also called as D2PP, A refers to the adenovirus, or 2 refers to the two types of adenovirus, and this is called as the canine adenovirus type 1 and type 2. These two types of canine adenovirus cause infectious canine hepatitis. So what are the other types of hepatitis in dogs? Well, it could be granulomatous, chronic active, suppurative and hepatic abscess, or cholangiohepatitis. All right, so those are the different types of hepatitis in dogs aside from infectious canine hepatitis, which is caused by canine adenovirus type 1 and 2. Infectious canine hepatitis is a very contagious disease of carnivores, which has been reported worldwide, infecting young animals, usually less than a year old. So this virus targets the eyes, the endothelium, and many parenchymal organs, particularly the liver. Okay? So what are parenchymal organs? Organs are composed of tissues, different tissues. Okay? When we say parenchymal, this refers to the functional tissues, because organs has functional tissues and structural tissues. Structural tissues are like collagen, okay? And when you say functional tissues, these tissues include different cells with specialized functions. With liver, 80% of its functional tissues contain hepatocytes. So how does a dog get infected with canine hepatitis? Infection usually occurs through oronasal exposure. So it means oro, mouth, nasal, nose. And once the virus enters the body, it would replicate in the Kupffer cells. These are macrophages. What is macrophage? Macrophages are cells which are usually first line of defense of our immune system. So they engulf or they try to eat the invading organisms. However, if the macrophages won't be able to kill these viruses, then of course the virus could survive. And if it survives or if it defeats the army of macrophages, then it could invade also other adjacent hepatocytes or liver cells. This invasion and damaging of nearby hepatocytes or liver cells would eventually lead to viremia. And when there's viremia, well, of course, the virus would travel to different parts of the body through the bloodstream. Then shedding might occur through the saliva or feces. So what are the clinical signs or probably symptoms that we could observe from the patient if they are infected with infectious canine hepatitis or adenovirus infection? All right, so the signs would depend on the severity of the case. It depends also on the immunologic status of the patient, as well as the initial cytotoxic activity. When you say cytotoxic activity, the initial damages that occurred in the cells. Because if you remember, I mentioned that after replication in the macrophages, it could invade other nearby hepatocytes, okay? So that destruction in that process would make the difference in the signs that we could observe. For example, we could observe signs from slight fever to sudden death. All right. So it has a very wide range of clinical signs. However, in general, we could also see sudden onset of fever. There could also be bleeding due to the liver damage. And also, there is blue eye, a corneal edema. All right. And in severe cases, seizure could also be observed because when the nervous system is already infected, then neurological signs would manifest. Cases of canine hepatitis could be peracute, acute, uncomplicated, or late. For peracute, it means it happens very fast. The progression is very fast and sudden death could occur. In most cases, there is also shock, so cardiovascular collapse would also happen. Then, the delivery of oxygenated blood to different organs could be impeded. And if there's a decrease of blood supply in the head or in the brain, there might be seizure. In this case, death could occur in few hours. That's the peracute form of hepatitis. How about the acute form? In acute form, there's also a fever. However, your vet might notice some abdominal pain when he or she conducts a physical examination. This would be because of a hepatomegaly or enlarged liver, or probably other abnormalities going on with the digestive tract. We could also observe anorexia. The dog could have decreased food intake, or it doesn't have great appetite. There could also be DIC, or disseminated intravascular coagulation. Okay, this is an abnormality with the proteins that are involved with blood clotting. Okay, so they become overreactive. That's why there's coagulation. How about uncomplicated cases? Well, there could still be anorexia, okay? And of course, the unspecific signs of illness such as lethargy. There could also be some gastrointestinal signs such as vomiting and diarrhea. In some cases, abdominal pain could also be observed, mainly because of hepatomegaly. The last type is the late canine hepatitis. So what can we observe? Well, usually this runs for a long time and there's enough time for the body to show or to develop other signs, okay? So this would include the blue eye, or this is actually a corneal edema. And this could eventually progress to corneal ulcer and glaucoma. So these are the signs that we could observe from the different types of canine hepatitis. So let's proceed to diagnosis. Usually, history is one of the first thing that we have to consider if a patient is suspected to be suffering from canine hepatitis or infectious canine hepatitis. All right, so what about history? Well, we have to check if the patient is vaccinated or not, okay? That's why this is one of the core vaccines for dogs, all right? First is vaccination. Second is possible exposure to other dogs that could have been infected or with history of canine hepatitis. Remember, transmission is through oronasal exposure, okay? Other diagnostic techniques that could be utilized would include serologic testing such as ELISA and also viral identification through PCR. In some cases, necropsy could be performed and some histopathologic samples could be collected. The histopathologic findings could include intranuclear inclusion bodies in the liver. So, if the patient has been diagnosed to be suffering from infectious canine hepatitis, what are the expected treatment that your veterinarian might discuss with you? Well, first, of course, IV fluids. We have mentioned also about bleeding a while ago, okay? Because if the liver is infected, usually there's a problem with bleeding. All right, so if there's severe bleeding, then blood transfusion might be performed. All right, aside from that, of course, we have to address the infection. So if there's secondary bacterial infection, antibiotics might also be used. We mentioned also about corneal edema. So the use of topical treatments such as eye ointment might also be included in the treatment regimen. This is to address the painful spasm in the eye. And in this case, corticosteroids are contraindicated. So, can this be prevented? Yes, of course. Again, through vaccination. That's why this is one of the core vaccines in dogs. And usually the vaccine is an MLV or modified live vaccine. Again, in 4-in-1 vaccine, the DAPP or the D2PP, either is the adenovirus or the two pertaining to the two types of adenovirus, specifically causing the infectious canine hepatitis. So this is the CAV or canine adenovirus type 1 and type 2. All right, so that's it about canine hepatitis. I hope you learned something from this lecture. Bye! Thank you for being with me here at Vet Talks with Doc Athena. I hope you learned something from this simple lecture, and if you did, please hit the like button. Also, if you haven't subscribed yet, please do so. You can reach me at Doc Athena Facebook page. Again, thank you, and I hope to see you again soon. God bless us all. Bye!